Hello everyone. So in this video I am going to tell you about the platelets. So as we all know, the normal level of the platelets, that is the normal count of platelet, is between the 1.5 to 4 lakh per mm cube. Please remember it that the normal amount of platelet is 1.5 to 4 lakh per mm cube. So this is the normal range of the platelets. Now the what is the function of the platelet? So basically the function of the platelet is to clot the blood. So function of the platelet is to in the blood clotting. So when if there is a how the platelet will function so that the blood will clot. So how the platelet will work? So platelet functions will in 3 steps. So first step is the platelet adhesion. So the first step is platelet adhesion. So first there is platelet adhesion will be there after the injury of the endothelial cells. So suppose this is a blood vessels and in this there is endothelial cells. So blood vessels were lined by the endothelial cells. So first step after the injured of the endothelial cell is the adhesion of the platelet. So suppose these platelet gets adherent to the endothelial cells. So with the how the platelet get adherent to the endothelial surface. So platelet adhesion is with the help of GP1B, or GP9 factor, or the other one is the von Willebrand factor. So these two help the platelets to get adherent on the endothelial cells. So the first function of the platelet is platelet adhesion. First, how the platelet functions. So first step is the platelet gets adherent to the endothelial surface. So now the second step after the adhesion, the platelets gets activated after adhering to the endothelial cell. So the platelet gets activated. So platelet activation. So this is the second step in which the platelets get activated. So the platelets get activated after adhering to the endothelial surface. Now how the what will happen after the platelet activation? So when the platelet get activated, the platelets release the contents. So the release of contents is happen. So release of contents will happen after adhering to the endothelial surface. So basically what is inside the platelet? So in platelets we have the alpha granules and the delta granules. Alpha and delta granules were present in the platelets. Alpha and delta granules is there. So from the delta granules, please remember, from the delta granules sac will release. Please remember it that delta is like a sac. So S in this, the S stands for the delta granules, S stands for the serotonin, S stands for serotonin, A stands for ADP, and P stands for calcium. P stands for calcium, or in other words, we can remember delta granules by the DANS. We can also remember it by DANS. So DANS means ADP, adenosine, DANS, adenosine. SE stands for serotonin and E stands for epinephrine. E stands for epinephrine. So these were the components which were released from the delta granules, while from the alpha granules all the factors were released. So what factors? So from the alpha granules we have factor 5. Other factor is the factor 8. Other factor is fibrinogen, and the other factor is fibronectin. So these factors were released from the alpha granules. So please remember that all the factors were released from the alpha granules, while sac is released from the delta granules, or we can say DANS is released from delta granules. So these were the contents which get released from the platelets once the platelets get activated. So this was the second step in which the platelets get activated. So after the activation of platelets, now what will happen to the platelets? So now the third step, that is the platelet aggregation, means lot of platelets get aggregated there. So platelet aggregation is going there. After the platelet activation, platelet aggregation is going there. So when the platelets will aggregated, means a lot of platelets get accumulated at a particular place. So how they will get aggregated? They get aggregated with the help of GP2B, GP2B, or we can say GP3A. So GP2B and GP3A will help in the aggregation. Please remember it. GP2B and 3A will help in aggregation, while the GP1B and GP9 will help in the platelet adhesion. So please remember, it is important question that platelet aggregation is done by GP2B and GP3A. So if the platelets were aggregating towards it, so suppose this are blood vessels, here a lot of platelets get aggregated. Now it means that fibrin makes the clot strong. So fibrin makes clot stronger, so it looks like a cement. So in this way a platelet aggregation is going there, and the particular place where the platelets get aggregated, that becomes the strong enough to prevent the leakage. So these were the three steps in which how the platelets will work. First step was the platelet adhesion is there. After the platelet adhesion, platelet gets activated, and after the platelet activation, the platelets get aggregated there and makes the particular site more stronger, so that the blood will not go to the leakage. So these were the platelet functions. Now in the next few 1 minutes I am going to tell you the bleeding disorder. So basically in the bleeding disorder, so either the bleeding disorder means either there is defect in the platelets or there is defect in the coagulation factor. These two will happen if there is any kind of bleeding disorder. So the bleeding disorder is either due to platelet disorder, platelet will not work properly. So first one is the platelet associated bleeding disorder, and the second one is the coagulation factor deficiency. Second one is coagulation factor deficiency. So in the coagulation factor deficiency means the coagulating factors were not working properly. So in this deep tissue bleeding is there. So deep tissue bleeding is in coagulation factor deficiency, while the superficial bleeding is in the platelet associated. So superficial bleeds is there when there is platelet associated. So superficial is for platelet and deep tissue bleeding is for coagulation factor deficiency. So the example of platelet associated, or we can say superficial bleeds example were like there is petechiae, there is purpurae. So petechiae and purpurae, these were the example of bleeding platelet associated bleeding disorder. While for the deep tissue bleeding, the example is like hemarthrosis, when there is in the joints there is bleeding. So arthrosis means the joint and hem means blood. So blood in the joints. So blood knee joint. In other word, we can say blood knee joints. Hemarthrosis. So it is the example of deep tissue bleeding, and the most dangerous deep tissue bleeding is, so here my last question, that is most dangerous bleeding is in the intracranial bleeding. So intracranial bleeding is the most dangerous. Please remember it. So intracranial bleeding is most dangerous. So that's all for today. I hope you get benefit of this video. Thank you. Bye bye guys.